Assalamualaikum everyone. My name is Saba Batool, and on behalf of Bahrain University Islamabad campus, I'll be presenting my topic of relationship between perceived interparental conflict and psychological distress among university students. Following are the topics which will be covered in the course of this presentation. First of all, it is understood that positive parenting and home environment and healthy attachment patterns between parents and child and observing positive interparental relationship can have a positive impact on child development even during the early years. However, sometimes parental figures disagree with one another, which may result in quarrels and conflict. And if these conflicts remain unresolved, then they may lead to interparental conflict, which will affect the child's mental health. Research shows that the children who are exposed to interparental aggression and violence in the early years of life are 7 times more at risk to develop psychological problems and behavioral adjustment issues. Such children try to understand the interparental conflict, the effect of interparental conflict on themselves and their family, and consider it to be a threat. How to resolve the conflict and who is responsible for creating this discrepancy. Most of the cases, the child blames themselves and internalize themselves to be the cause of this conflict. According to cognitive contextual model presented by Grice and Fincham in 2001, young people's perception of interparental conflict are shaped by cognitions and a context that affects their behavior and psychological adjustment. Coming to rationale, uh, people who perceive interparental conflict in childhood are more prone to develop psychological distress in later stages of life. Present studies examine the perceived interparental conflict on children's perception of various aspects of the conflict. This study also explores the relationship between conflict of parent and psychological distress of university students. It also highlights the problem individuals may go through because of perceived interparental conflict that affects their well-being and attitude towards life. This is the conceptual framework of the study, which shows that perceived interparental conflict leads to an increase in psychological distress. Following on the hypothesis of the study, there will be a significant relationship between psychological distress and perceived interparental conflict among university students, and there will be a significant gender difference on psychological distress among university students. Coming to methodology, research design is correlational. Sampling technique is convenient. Sampling was used, and 250 university students between the ages of 18 to 30 were considered for the study. The construct were operationally defined as follows. Interparental conflict was defined as consistent conflict between parents, which includes argument, disputes, and disagreements. And psychological distress is defined as state of emotional and psychological suffering caused by an external stressor. Here are the measures of the study. First of all, the participants were informed of the aims of the study. They were also given the right to withdraw in the consent form. Following were the demographics of the study. 2 scales were used, including children perception of interparental conflict, which consists of 48 items divided into 4 subscales, that is conflict, threat, self-blame, and triangulation. Liability of scale is 0.85 and 2.90. And Kessler's psychological distress, comprising of 10 items, liability of the scale is 0.91. Coming to results, the first table shows the psychometric property of the scale, including the number of items in each scale, mean score, over actual and potential range, and alpha reliability. The results show that all scales and its subscale have high reliability. Next is correlational analysis, which shows that there's a significant relationship between interparental conflict and psychological distress. Next is linear regression. Linear regression, table 3 shows linear regression. Results show that interparental conflict positively predicts psychological distress among university students, and predictor explains 13% variance in the outcome variable. Lex is table 4 non-parametric test, which was used to assess the gender difference in psychological distress among university students, and females shows more psychological distress than males. Now, conclusion. Interparental conflict is a risk factor for psychological distress among young adults, especially within children who experience unresolved or frequent and intense conflicts. They are more likely to exhibit symptoms of psychological distress, a higher threat, and greater conflict over time. Therefore, it is important to experience positive interparental relationship and home environment so that the child development and well-being and preventing mental health issues in later adulthood. Now coming to implication. Interventions can be designed to deal with psychological distress that arise from observing interparental conflict in early childhood. For therapists, it is also important to examine the parent-child relationship, strength of relationship, and attachment pattern between parent and child. The therapist should also take into consideration client's culture and family structure during history taking. Other than that, attachment-based therapy and relational coping strategies can be employed to decrease the impact of interparental conflict on the child. Thank you.